As nurses and doctors, you're in the ultimate caring professional role. You're the advocators, the counsellors, and you come to work to do the best that you can for your patients. But what if you could do even more for your patients to improve their safety, well-being, outcomes, and chance of survival? That's a pretty big call, right? So what more could we be doing as a service? What is the gap? What's the problem? After looking at speech path referral data and identifying key at-risk diagnoses or conditions based on the coding, it revealed gaps in referrals. The main gaps identified were for stroke patients and patients with swallowing and communication impairment. National Stroke Foundation guidelines state that all stroke patients should receive a referral to speech pathology. Currently at our service, 31% of our stroke patients are not referred to speech path. Risks of swallowing problems are as high as 65% in stroke, and communication difficulties are as high as 60%. Dysphagia, or swallowing impairment, puts patients at risk of aspiration pneumonia, which can be life-threatening. Currently, 38% of our patients with swallowing impairment are not referred. Communication impairment involves those other dys words like dysphagia and dysarthria. It increases the likelihood of adverse events in hospital, and it can lead to limited social activity, depression, and reduced likelihood of returning to work after a stroke. Currently at our service, 34% of our patients with communication impairment are not referred to speech path. So, what can we do about it? Swallowing and communication impairment, such as the ability to talk and clearly use their voice and understand what's being said to them, these are difficulties that are the bread and butter of speech paths. If you have concerns about a patient, refer to speech pathology. You are the ones that are in close interaction with patients day and night, so you're the eyes and ears and the advocators for these patients. There are 5 red flags to look out for: stroke, COPD, brain injury, head and neck cancer, and progressive neuroconditions such as Parkinson's disease. There are high rates of swallowing and communication impairment for all of these conditions. Some of them might come as a surprise too. It's also important to look out for the following signs and symptoms: a past history of swallowing problems, coughing or choking on food, drink, or own saliva, voice changes during eating or drinking, such as a gurgly voice, shortness of breath, an inability to sit upright, and reduced awareness or consciousness. So, if you see any of these symptoms, especially if your patient has one of the red flags, please refer to speech pathology. And if you're ever in doubt, you guessed it, make the referral. It's in your hands. Take action and refer to speech pathology.
Created using Powtoon.